All right, welcome back, everyone. Thank you so much to our first presenters of the day for that wonderful first session. We'll finalize our program today with a presentation from Skye Wheeler, followed by a panel discussion. And really excited to welcome Skye Wheeler, who has been a longtime collaborator and really spearheaded this project that we'll be talking about, which is Wombs and Wildfires that Nurturely and Human Rights Watch have been conducting for the past year or so here. I've had the pleasure of gallivanting around Oregon with Skye for the past week, and she Oregon is one of just a long list of places that Skye has worked, including many international places, Sudan, South Sudan. Skye is currently a senior researcher in the Women's Rights Division at Human Rights Watch. She monitors and documents women's rights abuses during human rights crises, including situations of armed conflicts and attacks on civilians, mass displacement, and crisis following disasters. And if wildfires are not on the list of that absolutely increasingly threatening list of human rights violations, we're here to say why it should be, and people should be considering it absolutely in that serious list. So I will stop there. Skye instructed me to not read her whole bio, so I will stop giving her accolades and pass the mic. Thank you so much, Skye.
Thank you. So my purpose for this session is really to try and get as much time with the panelists, but I'm going to start just by saying a little bit more about what Nurturely and Human Rights Watch are doing with the Wombs and Wildfire Project. Co-creating climate solutions that center perinatal health equity. Oh, this is our panel. Okay. So, so far we've spoken to between 25 and 30 maternal health providers and birth workers, or including birth workers, so doulas, midwives, primary health physicians. And also we've been lucky enough to also speak to a number of other organizations that are allies, climate justice workers, and government workers that are also providing services too. But the most of the interviews have been with birth workers or maternal and newborn health providers. And these are really some of the questions that we're asking. We know, and Dr. Sandy's amazing talk helped us understand that a little bit better. We know that we see at the population level harms on pregnancy health from wildfire exposure. We see the preterm birth, low birth weight as two adverse birth outcomes. But what we found that we weren't really finding was, how does it actually look from the perspective of someone who's serving pregnant people? Like, how do people actually experience wildfire? So these are some of the questions we were asking. And the first question, in some ways, is one of the most important. It's not actually about wildfire, but it's like, even before the wildfires became part of your work, what were some of the obstacles or barriers to a healthy pregnancy and a healthy newborn in the communities you serve? Because we're not seeing wildfires as something to be tackled solo. It's part of a pattern. It's part of many different intersecting pressures and harms on pregnant people that result in the inequities that we see across the US. What do you worry about most? Which pregnant people are you most worried about? How does racism, how does income or socioeconomic status fit into the harms that you see on pregnant people? We asked a lot of questions about advice, impacts. The impacts on yourself was not something I was started off asking about, but it became increasingly clear that there were very clear impacts on the people who are providing services as well as the people they were serving. What do you see happening already? What's in place to protect pregnant people? Are you prepared, as a birth worker or as a midwife? Do you feel ready for the next wildfire season? And what do you want to see put in place to better protect pregnant people. And just to say, well, we'll get to there. Yeah. So 5 key findings so far. So the first one, and this is really important to me and to Nurturely as well, is that really how much agency a pregnant person has to protect themselves is really a function of how much resources they have. So there's just this huge gap. The wildfire smoke is everywhere, right? Everyone's suffering. Everyone's stressed out about it. But there's these very different, like, what can you do about it? What's the seals around your window look like? What do you have an air purifier? Do you just have one, or do you have one in every room? Can you leave? Can you negotiate with your boss and say, look, I'm not comfortable. I'm pregnant. I just don't want to be here. Can I work from somewhere else for the next 2 weeks, 3 weeks? That's not an option for a lot of people. And there's an additional exposure also for people who work outside. And that's something Gabby's going to talk a little bit more about later. And then the other thing was we didn't have anyone say, well, we were not really thinking about premature birth, low birth weight, or those kinds of outcomes in this research. That really happens at a population level, and an individual doula or midwife would never be able to say this particular premature birth was because of wildfire smoke. They might feel that in their gut, and they might be right, but they wouldn't be able to do that. It's too complex. So we don't really look into that so much, but we did find like a surprising and very complicated picture on mental health from wildfires. And that was something that our interviewees did know a lot about and could say that is linked to the wildfire. And I'll talk more about that in a second. Birth workers want to be able to provide advice and to help clients take action. That's a really complicated thing. The science is still developing, like, how much information, what information is good information, people felt ambiguous about worrying pregnant people if there was nothing that pregnant person could do. So this is an area that's kind of sensitive and difficult. And then birth workers, I would ask them, like, what do you want? And, things like, we want to see air purifiers, we want to see wraparound services, but also they want climate action. This came up, like, people like, we're fed up, like, do something, like, let's get serious about the climate crisis. And again, that wasn't something I was thinking that people would be very interested in local, like, adaptation and resilience building, and they are, but they are also advocating for big stuff as well. And then generally people didn't feel hugely prepared for another wildfire season. And then this is just to say a little bit more about mental health. It's a whole rainbow of impacts. So trauma and PTSD, people who have experienced close proximity wildfire, who have been evacuated, lost houses, pregnant people who, like, maybe started off with depression and anxiety, being seen as a vulnerable group, and that stress and anxiety have impacts both on birth. We've talked about oxytocin already today, but it's like this sort of, someone described it as quite a shy hormone sometimes. Like, there's sort of this kind of delayed, people feel like it anyway, stress around the time when you're about to give birth is not great. And then also impacts on stress on breastfeeding and how much milk you actually produce. Communal anxiety, like everyone getting, I always love when I talk to people from Oregon about this, because they're like, yeah, we know. This is widespread, like people, it's a society-wide anxiety, loss, people who have lost housing, lost community, lost forests, climate grief as well, and the losses for birth workers who see themselves as working in alignment with Mother Earth. I mean, to be frank, like they see themselves as bringing life and being part of life coming forward into the planet, and that kind of been undermined by these pretty significant changes to our environment. And then I don't really know yet what I think about this, but I find like it's come up quite a bit that people feel that after the wildfires have gone, people don't want to think about it anymore. It's like, boom. And I don't know if that's quite climate denial, but there's this sort of like mix of an unwillingness to really deal with this new reality that I think might have like a mental health component, or it might be part of that spectrum anyway. Yeah. And then these are just some recommendations. I think we've touched on these today quite a bit already. Z's great presentation about some potential there with perinatal community health workers, advice, and then at the end, reproductive justice training, and more maternal and newborn health engagement. So that's like a vice versa thing. So we think that like government workers or people who maybe don't think about maternal health or reproductive justice very often, but are touching the climate crisis, would benefit from reproductive justice training, like understanding some of the concepts that Z talked about, that these should be part of how they see the world. And, you know, that the reproductive justice framework is a very useful way of approaching the climate crisis because it's all about justice. It's all about intersectionality. And then more maternal and newborn health engagement. So that's the other side of the coin. So maternal health work, you know, obstetrician gynecologists and health systems also learning more about the climate crisis and about some of the impacts that Dr. Sandy and Dr. Rupa have studied. Oops. Okay. All right. So we'll get into that later. But now it's time for our panel. Hello, panelists. So I have a couple of questions for each of you, and I was wondering if we could start with Dr. Rupa. Would you be able to tell us a little bit more about what we do know and what we still don't know about wildfire exposure and pregnancy?
Sure. So a lot of the studies that we've seen so far for wildfire exposure have been related to PM2.5, because that's what we, PM2.5 or smoke days, something related to that. So we're not really capturing the true effect of wildfire smoke. We're not getting coarse particles, for example, or, metals or anything like that. We know that the exposure from wildfire smoke in itself is more toxic than general PM2.5. We know that the constituents would likely be different just because of what's burning. So I think there's a lot more research that we need, but just recently there have been a couple of reviews on this field, and they have found a pretty strong association between wildfire smoke exposure and preterm birth and term low birth weight. I haven't seen as much done, or maybe it's been more inconsistent with infant mortality, stillbirth, and small for gestational age. But the other two outcomes seem to have some consistency, just like we've seen from heat exposure and general air pollution.
And the other question I had for you was sort of more general,
Sure.
Which is that as someone who's studied environmental health and been advocating in your work for more action for a very long time,
Mm-hmm.
Why is it, do you think, that air pollution never really got its day in the sun? I mean, we have the Clean Air Act, of course, but especially when it comes to pregnancy and pregnancy outcomes, like it's not something that a lot of people think about or know about. It's not something necessarily that clinical providers talk about a lot. Do you have any kind of instincts or thoughts about that?
Yeah, I think part of it is, so air pollution is ubiquitous, and we know that certain groups are more affected. But this message kind of, like I was saying earlier, stays within the scientific community. It doesn't even reach, the clinicians or the, other healthcare practitioners. And so if they're not getting that information, they're not able to give it to their patients. And if the patients don't get the information, they don't give it to their community. So it just, it's kind of like, I think that's the main issue, is that it's not really a high priority topic. And maybe with climate change, that is changing ever so slowly, but that's the main thing. I haven't even seen it in the curriculum until pretty recently. So that's, I think, the root of, there's so many other layers, but that's, I think, the root of it.
Thank you so much. Gabby Esquivel, she is a student and she's getting her master's in public health this spring. And Gabby is also a mom of 3 from Lebanon, Oregon. And extremely interestingly, for our Wombs and Wildfires project, Gabby, you also did some work with farm workers. Yeah. Can you talk a little bit about why this population is especially important to keep in mind when we're thinking about wildfire and public health?
Yeah, so I think as many of our presenters already discussed, there's so many toxic substances that are found in wildfire smoke, and it can affect everyone in general, especially people who are indoors and who are outdoors, but especially those who are outdoors. In regards to the question, pregnant farm workers who are working and getting this constant outdoor exposure to all these particles, not only are they affected on the general level of like symptoms that they can experience from smoke, such as like respiratory illnesses, as we see in the presentations, how this is linked to cardiovascular problems, and that it could enter, especially like PM 2.5, that could enter into the bloodstream, especially affecting the pregnant person. And as we've seen in the presentation, it also crosses through the placenta, which means that the baby can also receive the unhealthy concentrations of air pollution, which can also cause adverse birth outcomes. So they're especially very, as we say, disproportionately affected, because not only are a lot of these pregnant farm workers are just outdoors because that's their livelihood, a majority of them are also experiencing, as you talked about, Skye, and our presenters, economic instability. A majority of them are low socioeconomic status. A lot of them have lack of access to resources, especially healthcare, which could contribute to that, is like their legal status, especially how there's not really many protections still to this day in regards to that, and lack of access to language accessibility, lack of access to a lot of resources. Like maybe they aren't versed in digital formats and they don't know how to access, or they can't ask their community because they also feel isolated in regards to their community. Like, who can I ask? Who can I trust, especially with my situation? So they are very at large risk for a lot of these smoke-related illnesses. And as regards to still being, as we talked about, like they are in the situation that they aren't unable to move out. And especially when it comes to housing, a lot of them are in multifamily houses, low income housing, and a lot of them don't have AC. And a lot of them aren't able to access like air purifiers, or they're unable to access, like, for example, the Oregon health insurance, the state insurance, OHP, there you go. Sorry, Oregon Health Plan, because they're fear induced of like, oh, if I access this, they're going to get me, or they're going to find out where I am, when there's just not a lot of those supports and also the awareness of resources available to them. And thankfully now Oregon has gone forward, and also PICUN, which is a farm worker union organization that's located in Oregon, advocating for the rights of all farm workers in Oregon. They were able to pass with Governor Kate Brown the Oregon heat and smoke rules, which means that employers are responsible for maintaining those rules, as well in regards to extreme heat. At certain temperatures, they need to be taking it and be enforcing their protection wear equipment, their PPE, certain types of masks as well. This also goes in regard to wildfire smoke. They need to be able to find a way to monitor the air quality index and the levels, and be able to advise their employees and give them trainings on what they can do and how they can go back home without fear of losing their work and their income. Thankfully, we're doing well. It's a work in progress, right? Not all employers are going to be especially implementing this or staying by the book, and as well as also, you know, like OEHHA, it's hard, you know, that bandwidth, it's hard to visit all these farms and all these sites, especially. So it's hard to know the enforcement that's going on in regards to those laws and protection. But thankfully, Oregon just passed the right to refuse dangerous work, which is an extra protection. And to that, I'm so happy, because that means that farm workers have the right to refuse dangerous work, especially in extreme heat and then smoky conditions. They're able to refuse work without the fear of that they're going to lose their job. Mm-hmm. So we just passed that. So I'm really excited about that. So hoping that this is a step in the right direction to protect all pregnant farm workers.
Absolutely. It's exciting. So that was a wonderful response. Thank you very much. So like with Rupa, I'm going to ask you to like put one hat down and put another hat on. You're also a mum. You have 3 kids, and you've been had a lot of smoke and wildfires in your life. How do you talk to your kids about wildfire or the climate crisis? And what kind of emotions and experiences have they had because of wildfires already?
Yes, they already had an early introduction, as we said, in 2020 to the wildfires. It's really hard, in my own personal experience, it was really hard to explain to them that this is climate change and that this can happen human caused, and it can happen due to nature. My oldest is now 7, but back then he was like 4. So yeah, 4. It was really hard because he didn't understand. And for me to try to explain to him, especially like in simple terms, like, you know, wildfires, they do this to the nature, the environment. And unfortunately, with what happened, we had to stay in our apartment. Mind you, there's no AC. And even if we did have an AC device, like we couldn't turn it on. We had no way to go out and buy the filters, and we didn't know what to do. We just advised ourselves, especially with family members, like, oh, just put towels in the gaps. Don't open the windows. Just try to be safe as possible indoors. My children didn't really understand that. They were like, well, why do we have to be inside? And I just remember them being scared of seeing the sky go orange, gloomy, and me trying to explain the wildfires. It's like, they're like, is something going on? Like, what's happening? And as a parent, it's like, well, if I don't have the resources, and at the time I didn't, and even though I was still like an undergraduate student, I still wasn't, I don't think we were all well prepared for that, or even like the resources available was well prepared for that. So it was really hard to navigate that as a family, especially with the lack of awareness. And as growing up here in Oregon, I wasn't personally exposed to that much wildfire. So for it to be so close to like where I am from, like in Albany, and have a wildfire happen, like passing Salem and just driving down and seeing it all, the ashes come down, it's like, I was scared. Like, I didn't know what to do. And as a parent, it's like, our job is to protect your children. It's like, how can we do that if we don't have the information that we need? And when I called everyone else, they didn't know what to do as well. So it was really hard to navigate that. But as my children are getting older, I am explaining to them more, especially now that I'm in the work more. I'm explaining to them more, and they're starting to understand. But that's when my oldest is like more conscientious. He like, make sure that, okay, we got to do all these environmentally friendly things. And I'm like, yes, I'm like, that's what I want to be able to pass on to my children. So that way we can reduce our contribution to the emissions and be able to say, oh, you know what? If you want to go to the park, where are we going to drive there? Let's walk, or we can bike. Or just like, oh, we sometimes they want to drive far away to go to like other activities. And I'm like, well, let's find activities to do local. Let's find out what we can do in the nature as well. And let's just all have fun and just be able to appreciate. That way we can also appreciate our climate, and they can grow up understanding the appreciation and what we have to do to protect it.
Thank you. Jessalyn is Nurturely's program coordinator. And you're also a doula as well. So you're going to have a two-hatter too. So we'll start with your doula hat. And you helpfully touched on this a little bit in your comments after Z's presentation. But can you talk a little bit about the doula as a climate worker? What's the potential, but what are also some of the pitfalls?
Well, Z gave a really great overview of touching on how doulas work with clients directly and how different that is from the other care that a person might be receiving over the course of the perinatal period. So specifically, there's a few things I have in mind. One is I'm in somebody's home when I'm working with them. And as Zainab kind of showed in terms of the details around hydration, the air in the home, the access to a purification system, stocked groceries, some of these kind of basic day-to-day health and prevention measures, I get to navigate that with my client in a way that really honors the relationship I have with them. So whereas a pregnant person might go to get clinical care, they see their provider for maybe 10 minutes, maybe 15 minutes. There might not be a lot of time or space for a culturally humble, respectful, effective conversation. And if anything, it might look like a really brief warning that just causes a lot of stress and anxiety. So in the home, I can sit down with somebody for 20 minutes or 2 hours, and we can work through the solutions that are available to them. We can take pauses to ground our central nervous system if emotions or stress comes up in a way that the person starts to feel really fearful or panicking, which I think is a totally valid response, right? But I have the time to help that person regulate. And especially if they're pregnant, we've talked a little bit about the stress impacts on pregnancy. Whether it's for that one day or the rest of their life, any tool that I can give them to do that self-regulation is going to be a skill that they take with them over the course of their pregnancy and also in parenting. Because those stressful situations and those conversations that Gabby just described don't go away, right? Whether it's climate change or other stressors in the world, and we know that climate change is going to continue, we can't prevent every stressor or every traumatic thing that happens, but the ability to connect with other people and to regulate is actually what's going to protect our long-term health. So being able to do that in a respectful way in the person's home environment, I think is a huge piece of how doulas function as climate workers. Another piece, and this was mentioned in a few different moments, how it takes a lot of time for the science and the research that can get siloed in this community. It takes a lot of time for that to reach clinical practice. So in general maternal and obstetric practices, we see that it takes 17 to 20 years for quality evidence to be implemented into clinical practice, which is a long time to be. If there's this really good information about something we can do for a pregnant person, and it takes almost 2 decades for that to be implemented in a hospital policy, it's too long, frankly. But as a doula, and especially as a non-medical provider, I'm not beholden to waiting for my hospital to change their policies. I can put a Google alert on my phone on severe heat or Dr. Basu or Dr. Ha or whoever, and I get those updates. And maybe I'm in touch with CBOs or organizations like Nurturely, where I'm able to stay up to date on the issues that are affecting my clients. And I can tell them the next day, hey, this team just did this review of all the research, and we are seeing that this. So, you're in month 3 of your pregnancy. Let's talk today about what we can do over the next couple months to help you feel safe, to protect your body, to protect your baby, and to make a plan for when you have a newborn. And I get to do that instantaneously without waiting for regulatory bodies and medical institutions to decide that this information is valid. So those are 2 of the ways I think about it. And then advocacy it's multi-directional, right? It's the community and the decision makers. And as a doula, I get to be kind of a joint between those 2. One, I am a community member, so I can certainly share my own experience with decision makers. I can also accumulate the 20 or 200 families that I speak with, their experience, and express that to decision makers. Vice versa, I can share what's happening in policy with the families I work with. And I can also support my clients in becoming advocates, which to me is actually really core to the doula role, for health in general, for human rights in general, is highlighting the way our for-profit medicine system, racism in our society, highlighting these big systemic issues so that when my clients are navigating something difficult, instead of internalizing that and being like, oh, it's me, I'm dealing with this thing in my pregnancy and I just have to get over it and recover somehow, I get to help them kind of illuminate the fact that actually you have a voice, you have a voting option. Not everyone, but most of you have voting options. Hopefully we all can vote someday. And then in our system, as a health consumer, you have that consumer power to say what's needed, to make demands of your regulators, your legislators, your hospitals, your provider institutions. So I think that's the other piece of advocacy, besides directly relaying stories, is I can kind of do some of the work to spark that in the families I work with.
That's wonderful. Thank you very much. That was a very good response. So I think what I'll do now is play this short video that you and colleagues at Nurturely created, and then you have a few other excellent resources that you're working on, and maybe you could talk about them too.
And I'll say this video is one piece of content from our toolkit, and just this piece is a way to make simple, accessible pieces of content that providers and community members alike can use to increase and share more awareness about this intersection that we're discussing today. So I know that's really short, but that's because our community and anyone watching today, I think we all know that our attention spans can be kind of short. So something simple that highlights the change over time, and Dr. Basu actually pointed out in one of our work groups, the seasonality of wildfires is becoming less and less of even an issue because it's really an all year round problem. And we're also seeing, I think some of what was shared in the first presentations of maybe it's flooding, maybe it's drought, maybe it's fire. I was in Northern California for 10 years. I experienced all of those in the course of 5 years, or my peers who are still living there today did. So sometimes it's everything all at once. But something as simple as this shared to an Instagram page, put up on a screen in a doctor's office, can start a conversation and start orienting someone towards the fact that this intersection exists and needs to be addressed and that there are solutions. I guess I'll come up here for this part.
Got the clicker?
It's okay. Sure. So we have a toolkit. That kind of public awareness messaging is a big piece of it, just to start helping providers and families, and recognizing providers are part of the community to have that awareness. Another aspect of the toolkit is more direct resources around guidance and advice for people in the perinatal period. So this is one of a few different handouts that are accessible, written in simple language, also in Spanish, just highlighting some of the risks and complications we discussed and learned about today. Really kind of making that connection of what the studies show, that we're looking at long-term health, long-term function, as well as the acute risks of low birth weight, preterm birth, et cetera. And then really bringing some attention to the stress piece and the mental health piece. So there's a couple different pieces of content in the works. This is just one version. And, again, sometimes knowing the facts can be stressful. This is not fun information to read. But when a provider has this to go off of and they have that 10 minutes, this can be a starting place. And then that same document follows with some steps people can take. And again, I hope that there can be more integration between provider communities so we can be in the home, have some more continuity around these plannings, but preparing your home, taking preventative measures with your body, with your air, even practicing breathing techniques to manage stress, like something as simple as that regulation I mentioned earlier. And then also making a plan. So I loved what Emily shared about lactation as being both a response to climate, but also a way to prevent continued damage. But even just on the most day-to-day mundane level, if somebody is pregnant, for them to understand that being able to lactate and being able to wear their baby are things they can start preparing for now, and that are going to give them that much more bandwidth and capacity and decrease cost and improve outcomes, that can be really empowering. That's something that they have literally in their own physiology accessible to support navigating what's otherwise a really stressful event. So we have a few different versions of provider-client handouts that we hope to distribute across the state, the region, the country, whether it's doulas, physicians, nurses, home visitors, caseworkers, mental health therapists. So they have something straightforward and on hand that they can give their clients. And before I go to that, and then the other aspect of this toolkit will be continued learning and resource index. So whether that's the provider themselves, they want to jump into the research we learned about today, or if a client wants to go online, they can go to our website where we are creating basically a searchable index of the resources, the science, the articles, and even the tools around some of these more like day-to-day measures. So they'll be able to search that index. There'll be Spanish language resources available, a kind of a mix of academic work and more like public health messaging and steps you can take. And we'll continue updating that list. So whether you're in academia or medicine, or you're just a person trying to protect your family, you'll be able to go there and find regionally and language specific accessible information that can support you. So those are some of the goals of the toolkit. It's evolving really beautifully, and we've been meeting with people over the last 4 months in a cross-disciplinary work group, having lots of exchange around how to make this as accessible and effective as possible. You can join, right? Yes, which you can join. So if you're interested in participating in the continued development or just getting access to the toolkit, nurturely.org/wildfires is a good place to start. And if you're attending today's event, you've probably gotten an email from me, and you can always reach out to me directly as program coordinator.
Thank you so much, Jessalyn. I was wondering if we could just finish with a kind of sort of a bit of a global question, whether you might be able to speak to what you'd like to see happening in the next year on wildfire. And you could mention a few things or just one, and perhaps thinking both about policymakers, but maybe also just like the people who are here today and online watching this as well. Rupa, would you be willing to start?
Sure. So I think there's so much confusion around when a wildfire occurs. What do we do? There's not enough guidelines out there. From things like, should we go outside? Should we stay indoors? Because we know that the air is not necessarily better indoors. And then what do we do about school? Do we shut down? And at what level is safe and not safe? And I think these types of things are developing. I have seen something come out of Washington State, for example. So it is possible, and it is possible to get that out. You said within the next year. I think that could be definitely doable. And then the other thing is, I think whether we're talking about wildfire, heat, air pollution, anything else, it really, even COVID, the same populations are at risk. So, when I see research that says identify vulnerable populations. So I'm like, okay, well, what do you mean by that? Because they've been identified. We need to maybe work on interventions and strategies and things that will reduce exposure in a way. And I don't mean, we can't reduce environmental exposure, but reduce individual and community level exposure. This has to come from, small level, local community interventions. And of course, getting this information beforehand is really important. I know that now there's things that are being developed, such as apps on people's phones for people who have phones and have access to that, to do a smoke alert or a heat alert or something like that. But, how much time can we give? So can we give like, a day or two in advance would be a big difference than just like, okay, look, in 30 minutes, you've got to evacuate. And it's like, oh, my whole life is just being uprooted. We haven't even really begun to study the mental health impacts of wildfire smoke exposure, or the cumulative or the chronic impacts. But I think, all of that could be reduced so much with prevention, intervention, and guidelines. So.
Thank you very much. Gabby, would you like to speak to that?
Yes, there's a lot of things that I would like to see. I think we all would like to see a lot of things. But what comes out to me right now, especially as a parent, is having at the local and state level, being able to be educated in preparation and during and after wildfire. I really needed that, especially in 2020, and I believe we still need it now. I talked to a lot of families, especially in regards to the work that we've all been doing, especially, and what resources are available. A lot of them don't know, and they believe also like this, we as parents need to know, and I feel as a community, all the communities here especially, we need to know like how to act on it and what we can do to prepare, to reduce that stress and that trauma that is going to come from this, especially chaotic time, especially in season, as Dr. Rupa was saying, it's all year basically now. You never know, human cause, natural. I would like to see, especially, I know Nurturely is developing as part of the toolkit, like the wildfires mini course. Is that the mini course? I'm saying it? Okay. Don't want to butcher the name. The mini course, especially being able to, since it's going to be accessible, being able to implement that at the local and state level, especially in the school districts as a start for families to begin to learn, okay, this is what wildfires what wildfires are, the time of the year, how it can impact us, what can we do to act on it, whether it be advocacy for climate change, whether it be advocacy for preparation, emergency planning, or even spreading the information and being able to begin awareness, especially on the topics with families, communities, and being able to get that translated and hopefully like in Spanish as well and other additional languages, depending on the area which races or ethnicities are, populated, and how we can do so we can reach all, not just one specific population. I would also like to see a lot, especially perinatal tailored public health messaging. As we've seen and as we've been looking into developing the resource index, it's very limited. There's so many gaps that exist. There's not very perinatal specific, especially one or two presentations talked about it. There's no perinatal specific tailored messaging in regards to heat advisories. Dr. Rupa talked about it, heat advisories. There's no perinatal specific public health messaging in regards to wildfire preparation. If anything, and we all have to appreciate, the information that is accessible and out there. And I recognize that and acknowledge that it can be sometimes 1 or 2 pages on the website about these are the symptoms or this is what you could experience, and just prepare. And it's we need more to expand on that. Okay, what perinatal specific tailored messaging can we give out, especially local, state, federal level? When acknowledging that pregnancy is a vulnerable population, a lot of people don't know that, especially on websites. It's vulnerable populations. If you're going to talk to, especially communities who aren't versed in like the digital language or digital accessibility, and if their families don't know some of the terminologies, how do they know if they're vulnerable? How do they know? And if they find out the same day, it's already too late. How are they going to prepare? So I really like to see more perinatal specific tailored messaging and even tailored programming. I know Nurturely has been doing that. A lot of organizations have been doing that. Just being able to expand that more, especially local, state, and federal level, so we can be able to tackle all the perinatal inequities and especially health and racial inequities that exist.
Fantastic.
I don't know if what I want is realistic, because I want the defense budget to give us funding for this because it's a matter of national defense, right? I think these issues are a matter of global human existence, but also in the United States, specifically reparations for Black and Indigenous and migrant communities, because as Emily spoke about earlier, we are the source cause of so much of the consumption and industrial impacts that cause the emissions that are creating these crises. So I don't know if I need the executive branch to call it reparations, but I need them to prioritize and take the climate action that so many birth workers are demanding. Permanent clean air protections, permanent clean water protections, permanent funding for science and implementation around forest management and agriculture. Permanent funding for these things. And that needs to be named. And the other piece of that is also really like no questions asked, providing the protective equipment, the housing improvements, and the information to the communities most impacted for free. That's what I want.
Great. I think that's it. That was a great panel. You guys did brilliant. Thank you very much. Yeah, it was great to sit with you.
Thank you.
Great. Emily.
Let's give one more round of applause to our amazing panelists. Thank you all for sharing your experience and expertise. Thank you, Jessalyn, for that ending, because yes, it needs to be urgent, it needs to be permanent, it needs to be now. Hopefully all of you have picked out some gems from today, from all of our amazing presenters, knowing that we all need to be doing things all the time. It doesn't mean that you need to do everything, but it means that if we all work within our bubbles, within our own positions of power, however small that may feel, working in the ways that we can work to demand climate action on a large scale, but also knowing the power that happens with the small actions that we can take on a day-to-day basis, knowing that we are centering this work in perinatal health equity, in climate justice, and knowing that every moment of this work counts. So with that, we will close for today, also with an invitation to continue being involved. As Jessalyn mentioned, Jessalyn and Gabby and Skye have been leading these Wombs and Wildfires work groups. This is one component of our ongoing work where we're attempting to bridge these silos and co-create solutions together. We look forward to more collaborations with all of you to continue getting these data, this research out to the amazing workforces of birth workers and climate justice advocates on the ground who are doing this work on a daily basis. So please reach out for continued collaborations. Thank you again to all of our supporters and partners, all of the people joining virtually. And please don't forget to fill out an evaluation before you leave. And thank you all. Look forward to seeing you next time.